Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
If your gums hurt when you brush, could that sting be your body's early alert that heart disease, diabetes, or even depression are gathering speed? Welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're turning a spotlight on what painful, swollen, or bleeding gums may be telling you about your entire health story.
And I'm Alara Skye. We're diving into a massive study of over 500,000 people that links gum discomfort with a sharply higher risk of living with several chronic illnesses at once. By the end of our time together, you'll know why listening to your gums could spare you years of hidden trouble.
Let's start with the headline number. In the UK Biobank analysis, 57% of participants already had at least 2 chronic conditions, yet only 18% reported gum inflammation. Among that 18%, the odds of being multimorbid, that's 2 or more long-term diseases, jumped by 15% compared to people without gum issues.
Pain stood out even more. 54% of all participants with multimorbidity reported painful gums, making pain the single strongest predictor of broader health trouble. Loose teeth and bleeding mattered, but pain was the flashing red light that clinicians and you should never ignore.
Researchers traced the mechanism. Inflamed gum pockets become breeding grounds for harmful bacteria. Those microbes and the inflammatory signals they trigger slip through damaged tissue into your bloodstream. From there, they inflame distant organs, including your heart, lungs, and even your brain.
That journey explains why oral pathogens turn up in unexpected places. DNA from gum-dwelling bacteria has been detected inside arterial plaques, while separate investigations link the same microbes to the brain changes seen in Alzheimer's disease. Your mouth isn't isolated, it's a launch pad.
The study's lead author, Dr. Niseshon Siripai-Boonpong, stressed that clinicians often overlook the mouth when assessing risk for diabetes, cardiovascular disease, and depression. Yet the mouth is both problem and solution. Catch inflammation early, and you may break the chain connecting gum disease to chronic illness.
That brings us to action steps. First, brushing and flossing every day isn't optional. Use a non-fluoridated toothpaste and a soft bristle brush. Remember to wait about 30 minutes after eating before brushing, giving your saliva time to neutralize acids that weaken enamel.
Technique matters too. Angle the bristles toward the gum line and make gentle circular motions. Rushing or scrubbing too hard scratches enamel and irritates gums. After each use, store your brush upright in the open air so it dries thoroughly, and replace it every 3 to 4 months.
Floss at least once daily. Move the strand in a C shape around each tooth to sweep plaque from places bristles miss. Choose floss free of PFAS chemicals and fluoride to avoid adding toxins while you clean. Finish with a tongue scrape to remove lingering bacteria.
Consider oil pulling as a bonus step. Swish a tablespoon of coconut oil around your mouth for about 10 minutes, then spit it out. Traditional Ayurvedic practice and modern research alike note reductions in bad breath, plaque, and bleeding gums when you make this a habit.
Diet backs up those mechanical steps. Load your plate with fresh whole foods that tame inflammation naturally. Steer clear of ultra-processed products, refined sugars, and white flours. Each fuels systemic inflammation that worsens gum disease and strains every other organ system.
Certain nutrients deserve special mention. Consistently bleeding gums can signal a lack of vitamin C. Low vitamin D also correlates with higher periodontal risk. A simple blood test and diet rich in colorful fruits, vegetables, and sensible sun exposure can shore up both vitamins.
Let's zoom back to the bigger picture. Gum tissue regenerates faster than most other tissues and faces relentless bacterial challenges, which makes it an early casualty of body-wide stress. When your gums flare, they're revealing stress on your immune, hormonal, and metabolic systems long before other organs cry out.
That's why the UK Biobank data linked gum pain with conditions ranging from heart disease to anxiety and alcohol-related illness. Shared risk factors like poor nutrition and chronic stress tie these problems together, but gum inflammation often surfaces first, giving you a crucial window for intervention.
The good news is that gingivitis is reversible, and even advanced periodontitis can be managed and slowed under professional guidance. Partner with a mercury-free biological dentist for regular cleanings, and treat any soreness or swelling as you would any other persistent pain signal.
Practical measures extend beyond the clinic. Manage daily stress with adequate sleep and mindful breathing. High cortisol feeds inflammation everywhere, including your mouth. Stay hydrated to support saliva, your body's natural oral cleanser. And avoid tobacco, which sabotages gum tissue directly.
Alcohol deserves caution, too. The study found links between gum disease and alcohol-related illness, underlining how frequent drinking worsens oral inflammation and loads your liver with extra work. If you choose to drink, do so sparingly and balance it with nutrient-dense meals.
Throughout today's discussion, one theme stands out. Your mouth mirrors your inner health. You wouldn't ignore chest pain, so don't shrug off gum pain. It's not cosmetic, it's communicative, telling you that inflammation is already on the move.
Here's your challenge. Tonight, give your gums a 3-minute audit. Brush gently, floss mindfully, scrape your tongue, and finish with oil pulling. Note any soreness, swelling, or bleeding. If you find trouble spots, act now. Upgrade your routine, adjust your diet, and book that dental appointment.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.